The topic of this video is how is NUCCA practice different than the traditional type of chiropractic? And there are four main items that I'd like to discuss. One is how we are a specialist in returning the head and the neck back towards center. The whole idea there is that as the head and the neck are returned back to center, the pelvis, which is the foundation of the spine, will line up underneath the head. So we can see it in this little example here. Is in this particular situation, the head and the neck are shifted off of center off over to the right. As the head and the neck shift off over to the right, the body will tell the muscles in the back to contract in order to shift the foundation of the spine, the pelvis, to get underneath the head. As the pelvis shifts to get under the head, the leg is contracting up. So we have a contracted leg and a distorted pelvis because the head is off center. So what we do in our NUCCA practice is bring the head and the neck back to center in a very, very specific way. One of the other differences is that we take three very specific x-rays in order to determine the exact relationship of the head to the neck. We are then able to determine at what angle we need to adjust in order to bring that head and neck back into proper alignment. The other thing that is a little bit different with our x-ray procedure is that we take two more post x-rays when we get done with the initial adjustment in order to find out what kind of correction we were able to attain on that first go around. That gives us more of a blueprint as to what to do afterwards to either make some changes in the adjustment for a better correction or leave things alone because it was a very, very solid correction. One other aspect of why and how NUCCA is different than the traditional type of chiropractic is that the adjustment is very light, very shallow. One of the misnomers is that it's a low force technique. Well, there is force in the adjustment, but what allows the patient to feel so little is that the adjustment is only a 1/16 to an 1/8 of an inch of depth. So there is no cracking, twisting, popping, pulling, pain, nothing involved. The patients often feel very, very little, just the weight of the hand on the doctor on the patient's neck. And finally, the last thing that I think is one of the most important things is that we want you to get better, and we get you better by having you hold the adjustment to stabilize the adjustment. So with the correction that we're able to do, we bring the head and the neck back straight, the pelvis lines up underneath it, and therefore the better job we do at bringing the head and the neck back towards center, the less you have to see us. So the goal here is to see less of you, not more. We do not want you dependent upon us. Our goal is if we can get a really, really solid correction and then follow up with you and make sure that it's stabilizing over the period of about 6 weeks or so, maybe 2 months, then we have done our job by having you maintain and hold that correction. As you hold that and you have a little bit of a history with holding, then we kick you out. And the goal is to see you maybe 2, 3, 4 times a year, not more frequently than that. So thank you very much for your time and listening to this video. Hopefully it clarifies a few things, and hope you have a great day.